purpose behind pulling together this case study was to really dig in more deeply around what sustainability means for school mental health. We talk about it, we read about it, but what does it actually look like and feel like? And by doing the case studies, we were really able to in-depth examine how in 3 places they have put together a sustainable business plan and what were the critical pieces they needed to have in place in order to make that work. And we want to be able to document more carefully what those pieces are, how other people might learn from those pieces, and how they might be able to use them to sustain their programs going forward. The question we are trying to answer in these 3 case studies was, how do you move beyond the language of braided funding, blended funding, sustainability, to the how-tos? How did you make it work? What did you have to have in place? Who had to be at the table? What pieces needed to be put in place in the school mental health program to make it viable? We hope people will learn after reading this case study what are the essential elements they need to put in place in order to have a viable business plan to sustain their school mental health services. What should they be thinking about? Who do they need to have at the table? What are their service delivery? How to balance early intervention prevention with services that are actually billable to insurance companies? How to bring together all of the right pieces of funding so that we can not just sustain the school mental health programs we have, but really look to grow them in the future.